don't answer unknown phone calls. His phone keeps ringing. Then I finally get a text message, "Hey Abigail, I'm with your daughter, please call me. Alicia's been in an accident, I need you to come as soon as possible."
It was very scary, honestly. I was just worried. I was holding my stomach because that's where the pain was mostly. My pain was in my stomach. I wasn't thinking about the glass in my face. I wasn't thinking about my bones or nothing like that. I was just worried about my baby because that's where I felt the pain. I just held the baby the whole time till the ambulance came.
I'm Dr. Bazell. I am one of the OBGYNs who practice here at Southside Hospital. I also serve as the medical director for OBGYN for the Richmond market of Bon Secours. I happened to be on call on November 19th. Overhead page comes on.
Medical alert, OB emergency, stat trauma.
It's kind of the code term when there's an emergency. And I heard it. I was in the middle of seeing patients, stopped and just kind of ran over to the emergency room.
When there is an emergency that happens within the hospital that deals with anything OB, I show up if I'm in the building. So I go down to the ER with my staff and I help them with whatever they need.
From my standpoint, my brain's like already going. We don't know who the patient is. We don't have a name. We just know we have a 28-week pregnant female. So I'm like processing, okay, is the baby okay? Is the mom okay? Is she bleeding? What's going on? And the minutes are seeming like hours. Like, okay, where's this EMS? We're counting minutes at this point.
I get into the ambulance. She's in a neck brace, completely nude and bleeding, and I see blood just coming through her. So when I got there, they were like, "We're transporting her to Bon Secours in Petersburg. We'll meet you there."
She rolls in with the EMS, she's on the stretcher.
When we arrived in the ER, our OB physician was in there and we did a bedside ultrasound as the emergency room doctor is assessing mom, we are assessing baby.
I get a view of the baby, and I'm sorry if I start sounding like I'm emotional. Get a view of the baby, I see a heartbeat, and I see the abruption. I'll say this, you have to have a significant amount of a placental abruption to see it on an ultrasound.
We knew immediately that it was an emergency and we needed to deliver this baby. Time was not on our side.
I remember vividly leaning over and she's blooded up in her face. She's got cuts and lacerations and everything. And I'm like, "Hi, I'm Dr. Bazell. I'm gonna take really good care of you. Your placenta is separated, but we're gonna rush you for an emergency C-section right now. And we're gonna make sure that you're okay. We'll make sure that your baby's okay." And I turned and I felt her grab my hand. And she goes, "Dr. B, it's Alicia, it's me. It's me. I just saw you on Friday." And that's when, for me, it was like, they're my patients. All the patients we take care of, you're like, I'm gonna do our best for it, but this was my patient. Like, there's a bond already there.
The last thing I remember was Dr. Brazil saying, "Where's my knife? I gotta cut her open." Before he got transferred, I got to see him. He was in a little shuttle bed. They had him covered up and everything. It was plastic all around him. And they told me he was gonna have to be transferred to St. Mary's.
So Southside Medical Center is a level 2 NICU. For us, that means we take babies that are 30 weeks and above. The baby happened to be 27 weeks, which means while we have the capability to stabilize him, we don't necessarily have the capability to continue his care. So that was the doctor to send him to St. Mary's.
When I think of critical care transport team, I think of an ICU on wheels. It is a mode that we use to transfer our patients across the system. So we have hospitals in many different areas, and sometimes patients need to go from one hospital to another.
In a NICU transport for a 27-week-old baby, there is no time to figure out how the baby is responding to therapy. We have to monitor it the whole time. We're in the back of our unit. That is our NICU right there. We've got a doctor, we've got a nurse, we've got a respiratory therapist and a paramedic. All hands on deck. Everybody's paying attention to what's going on with that baby. Because on the highway, we don't have a hospital to pull over to. We are it. We're the hospital.
This is an intensive care, like a NICU room.
all in one place?
The primary goal of our truck is we do inter-facility. So we will not do 911, but we will go from facility to facility, generally within an hour or so, but we have gone outside for, any kind of necessities, but it's for higher level of care.
Most other transports teams only have EMTs and paramedics, and our scope is very limited compared to their scope. So we're able to handle much more critical calls and be able to handle more tougher medical situations if they do arise. The one thing that stood out to me for this particular run is how small the baby was, and also what was going on with the patient. We had to use TXP.
The thing that makes the TXP so special is the way it provides ventilation. You can set it up to a very high rate, like 520. So basically it puffs air. Here we're at about 515 breaths per minute. It's a very effective way of ventilating NICU babies. It can be used on adults too, but it's really important and really successful for our small babies. I truly think this had a meaningful impact on Messiah's outcome.
This is Messiah. The way he came into the world is not how he looks today. As you can tell, he got a lot more meat on his bones. He's a tough little boy. He's strong. And he just Messiah.
Once they found out that I was the father, that's when a lot of things kicked in. They made sure that the questions that I had was answered, and the concern that I had, they answered those. I felt like I was treated with a high level of respect here.
I just want to say thank you to everyone, because a lot of people don't make it out of accidents. So just for somebody to help me and truly take their time and just help me and my baby, I just thank everyone. I just thank everyone and appreciate everyone.
I would say thank you, and I really appreciate it. And Messiah appreciates it as well. He tells me every night that he appreciates the people at Bond Secure.
Patients would ask me, how many times have you done this or whatever it is? And I was like, well, I'm just being guided. I'm just being guided because I truly believe there is an ultimate physician and surgeon, a heavenly physician and surgeon, and I just happen to be the earthly instrument that gets used to be served. So, it's
Medical alert, OB emergency, stat, trauma Bravo.
We're done.
Thank you. Medical emergency. Medical alert, OB emergency, stat, trauma Bravo, trauma 2, ETA 5 minutes.
I can't imagine losing both my daughter and then my grandson, and the fact that people actually donate to help. My kids wouldn't have made it. My babies wouldn't have made it. So thank you. I appreciate everything, every single thing that you do. I appreciate it, and there's no words. God bless you. God bless you.